So during COVID, things changed dramatically in many regards when it came to medical care. But one of the things that seems to be sticking around is the ability, for some practices at least, to take part in telemedicine and other electronic avenues that perhaps didn't exist or weren't widely used before COVID became a thing. Paul Seegert at PCS Advisors works with medical practices nationwide to help them be more effective, and he is joining us live this morning. Paul, telemedicine, here to stay?
Oh, yeah, here to stay for sure. And anytime you have something that gets mass adoption, you end up getting billing codes, and providers work out a way with insurers and payers that they can bill for that service, which we're seeing here when it comes to what are now called e-visits, when you email your provider.
So it's funny because what you just said is so true, but I think a lot of folks don't think about it. I certainly didn't until I remember having a telehealth visit, just a generic thing during COVID. And I don't remember how it was billed, but then I had another one, within the last couple of months. And it's a whole different ballgame now. So it's exactly what you said. There are billing codes. There are systems that are now in place. I see it pop up on insurance policies. What other things that kind of were born or came to be during COVID do you now see as a profit center where there's huge benefit to the practice and also to the patient?
Well, I think this e-visit is a good example. We'll have to sort out with payers what is a reasonable amount to charge. We're seeing it vary anywhere from $3 on the low end to $160 on the high end for a provider to respond by email. And it seems that the standard is anything that takes expertise and 5 or more minutes for them to respond. So on the e-visit side, that's what we're seeing, and I think that definitely will be here to stay. You've got organizations, big ones, Cleveland Clinic, San Francisco, UC San Francisco, UC San Diego, the Department of Veteran Affairs, just a laundry list of big systems that are adding this in. And there were other things that were pioneered during COVID too that I think have a future. Home hospitalization is an example, as crazy as that sounds.
Is that the way it sounds? You get people to come in and I mean, essentially take care of you, not like home.
Yeah.
Okay. All right.
You're in your own home, but they can set you up with the same level of care for certain things that you might have had in hospital previously.
Absolutely fascinating. Back to the billing thing. I mean, from your bird's eye view of all of this, is there pushback? Is there pushback from patients who say I shouldn't have to pay for an email? Or is it the opposite where, and I kind of look at this and say kind of what you said, which is I'm paying for somebody's expertise. For the love of all things, I don't have to get in my car and actually go to a doctor's office and wait there. So it's win-win. I'm happy to give you $10. I'm happy to give you $20. I would hope the insurance companies would be saying the same thing.
Yeah, I think it'll get widely adopted and accepted. There is some pushback. Some parties believe that it will discourage people from interacting with their doctor. But the vast majority of communications will remain free. If it's simply a follow-up question from a prior in-person visit, or you need to get a prescription refilled, this kind of thing is still not going to result in a charge. But if you're asking for significant medical advice, then it will result in a charge. And I think most reasonable people think providers should get compensated for their expertise.
Yeah, well, definitely interesting. And as we see, by leaps and bounds, things changing, I guess, computer-wise and AI-wise, and certainly medically, how it all comes together, I think that we're in for some very interesting times. But the other thing I'll say to you real quickly here, I'm kind of blown away, and I'm fortunately not somebody who uses the medical system a whole lot, but a brief interaction, I'm blown away by the online record systems that now exist. To be able to log in and see everything and see notes from a totally innocuous appointment, but there's suddenly a transcription of notes there. And as it said in the system I was looking at, to help you remember, this meeting, down the road. So I think it's all interesting. Paul, I really appreciate your time. We look forward to having you back on in the future. That's Paul Seegert of PCS Advisors. He works with medical practices nationwide to help them be more effective. And certainly medical records online would certainly seem to be one of those avenues. Paul, thanks.